Hi everyone. Today we're going to talk about a case where it's a severe arthritis pain on the lower limbs. So basically this patient has pain from the lateral side of his knee, goes all the way down to the top of his ankle, so this area. And also he had a lot of numbness, tingling at the bottom of his foot. And he started, basically went to a family doctor, and the doctor diagnosed him of arthritis, and the doctor could only give him painkiller or drugs for reducing arthritis pain, but he couldn't do anything to treat it. He took the drugs and it didn't reduce much of the pain. So he came to me, and he was I've seen this patient before, and I was pretty aware how his body is. So basically this patient, he had a lot of blood circulation issues, especially with the blood going back to his body. So meaning the venal circulation has a lot of issues. So so normally this is a healthy vein. It's very straight, narrow, and normally there are valves in our veins to stop the blood from going backwards. So vein only sends the blood back to the heart. So these valves stops the blood going in the opposite direction from the heart to the limbs. But when these valves are starting to have some problem, or when there isn't enough power of sending all those venal blood back to the heart, they're going to start accumulate in the veins, and it's going to expand the veins to look like there are protrusions. So if you have seen people with varicose veins, you can see from the skin that it's quite bumpy along the veins. So this is what's happening there. And so this patient, I know he had this type of problem. And so when I took a look at his legs and foot, he also had a lot of tiny purple veins around on the medial side of his ankle. So these purple veins are actually our body's coping mechanism to help solve with this issue, because all the bloods are accumulated here. It cannot go back to the heart. That's why our body grows new tiny veins to help release the pressure and help the blood go back to the heart. So that's why he had a lot of these. So after diagnosis and examination, his pain was mostly on the stomach meridian, gallbladder meridian. So I quickly found two dark purple spots, not looks like these, but a little bit thicker and darker around his knee. So I did what is called a bleeding treatment. So the bleeding treatment is we took a very tiny needle, and we make a kind of poke at the vein to basically release this pressure, so the unhealthy blood that's accumulated in the vein can get out of our body. Sorry, my pen is out of ink. Anyway, so once we poke the vein and the blood releases, we can reduce the pressure in the vein. That will help promote the blood circulation. It's almost like plumbing, right? When you have something that's stuck in a pipe, you found another exit for the clog, and that will fix the plumbing problem, so the pipe will be flowing smoothly again. So that's what I did around where I found the upstream of the of the problem. Basically, the foot is the problem, and I will look for the dark purple veins from the ankle all the way up to the knee area, and I found 3 around these area that's also on the meridian, also on the affected meridians. So the first 2 on the gallbladder and the stomach meridian were on the lateral side and the anterior side of the knee. They were, when I pricked the vein, the blood that came out was very dark and very thick. And usually when we do perform this procedure, we let the body stop the bleeding by itself, so we don't purposely stop the bleeding with the pressure or cotton ball, because these unhealthy blood does not have the coagulation function anymore. So when all the unhealthy bloods are removed or came out from the vein, the healthy vein can replace these unhealthy. The healthy blood can replace these unhealthy blood, and the healthy blood has the coagulation function. So the bleeding will be able to stop by itself, and the color is more bright red than dark or purplish. So those 2 areas there's some amount of blood, but it wasn't a lot. But when I did the back of his knee, there was a lot of pressure built up in the vein. So when I actually poke at the vein, the blood kind of shoots out about 3-4 inches away from his knee. So that means there's too much pressure building up from in the veins of his lower legs. So after bleeding, he immediately felt much better. The pain level went from 10 out of 10 to like 6 or 5 out of 10, because we help reduce the pressure in here. And these pain are caused by having too much pressure in the vein. And so once we found the source of the problem, we can fix it very quickly. So this patient came for the treatment once a week, about 5 times. And after five weekly treatments, I follow up again after 3-4 weeks. He had no more pain with his foot. He was able to do any exercise or any house chore that he wanted to do. So this is another successful case with acupuncture, and I just want to introduce this bleeding method. It can work very quickly when this type of when the blood circulation is the cause of the condition. So if you have any comments, feel free to leave it below, and I will answer them when I get a chance. And that's it for today's case, and I'll see you next time. Bye.